Surrey Heartlands has been an integrated care system actually for some years now. We were in the first wave, and so we've learned quite a lot from that. But there is more, definitely more to learn. For those of you, I apologise on behalf of the NHS, who, as we know, can only talk in 3-letter acronyms. So the integrated care system is actually a misnomer. There are 2 parts to that. The Integrated Care Board, which Ian Smith chairs, and that is, although it isn't an absolute split, but is largely focused on the sort of clinical aspects of the delivery of health outcomes within Heartlands, and then the Integrated Care Partnership, which I chair, which brings together the wider partnership, the local government, health, the voluntary sector, carers, and so on. And between those 2 organisations, those two parts, component parts, we are responsible for delivery of the 100% of the wider determinants of health. So it is our job to make sure that we improve health outcomes, lives and livelihoods for our residents, for our patients, and to absolutely address those inequalities. It's very easy to say, very difficult to deliver, and that's partly what we're going to be talking about today, about how we can make that more effective. I think, sadly, but it is a really interesting time, actually, nationally. We've got, it's absolutely up there, perhaps for the wrong reasons at the moment, but the conversations around the health system, around waiting times, whether those be for elective surgery or ambulance waiting times. But, we are in a different phase now, post-COVID. The challenges are different and the solutions, I think, are different. And we've got to step up and deal with those. So, we have the Hewitt Review, the review led by Patricia Hewitt, which will be reporting next month. There are some sensible recommendations that will come out of that review. The good thing is that it's sponsored jointly by the Department for Health and Social Care, but also the Treasury through Jeremy Hunt's involvement. We all know that money is part of the solution to the issue, not the entirety of the solution, but we do know that particularly long-term funding and a commitment to long-term funding is absolutely essential if the whole system, the ecosystem, is going to go through a process of transformation, which I suspect many of us think it needs to do. So we've got that. We had yesterday I don't know what it was called now, but the urgent and emergency care something or other delivery plan. But which sort of makes my point in a sense that we have got to stop the top-down sort of directives. One of the key recommendations of the Hewitt Review will be the empowerment of the local integrated care systems. Hopefully many of you, and Rachel Crosby will introduce it in a minute, but hopefully many of you were able to contribute to the ICS strategy. That is a living document and needs to be a living document. But that is what this ecosystem, our local ecosystem, has identified as the issues and indeed in many areas the solutions. And quite frankly, all that NHSE need to do and DHSC is let us get on with it. Give us the money, we will do it here. And that's I think all 42 ICSs would say the same. To be fair, not all of them are actually as advanced or mature as we are in Heartlands. So there needs to be some support alongside that. But, let's have a very few kind of national outcomes and then let us, and don't tell us how to do it. Tell us what you want within reason, but let us work out how we're going to deliver it. And I think if we can get to that point, then I think we will see some genuine progress and improvement. So today really is an opportunity to network. Hopefully you've been to see some of the market stalls and had a chat with individuals there. Very grateful to all of those individuals that have given up the time to come today. It is primarily around the launch of the ICS strategy and to socialise that with all of you. It's not. It's not a definitive document. It's a framework, and we need to build that up over time. But actually, this is all about partnership working. This is about all of the things that you do, excuse me, in your organisation and how we can align those ambitions and focus on those joint outcomes that I know that we all are striving to do. So how do we kind of stop turf wars and stop finger pointing and actually just focus on the individuals, our neighbourhoods, our communities, in all senses. And I've forgotten to mention the slide that I think Giselle has put up here. Just to remind you, of course, that Surrey, the county of Surrey, has 1.2 million residents, 500,000 households. But Surrey Heartlands excludes Surrey Heath, the borough of Surrey Heath and Farnham, which is about 150 broadly, and that sits in the Frimley system. So we have two systems, two ICSs to deal with in terms of the County Council's responsibility around the delivery of social care. And what we need to make sure, and will make sure, is that the overarching health and wellbeing strategy that we have for this county and the three key priorities, those are the focus. So part of this is about looking at subsidiarity. How do we get the system right down into that sort of frontline local neighbourhood? And over the next couple of weeks or months, we'll be talking more about the initiative around using towns, our towns, of which there are 27 main towns in Surrey, as a sort of the footprint for delivery of both health and local government services. That is, and we have basically five acute hospitals. So, it's a complicated system, of course, but our job is to navigate through that and, as I say, to focus on how we can improve people's health outcomes.